Today we're going to be talking about autopsies. So, an autopsy means to see for yourself. Basically, it's a surgical operation on a dead body. The reason that autopsies are performed is to learn why a person died, so manner and cause of death, as well as the mechanism of death. So, once again, manner of death is figuring out, is it natural causes, accidental, homicide, suicide, or unknown. And then cause of death would be what happened, and then mechanism of death would be the bodily function that stopped leading to the death. A pathologist is any physician whose specialty is the study of or scientific study of body parts. So, anytime there's a suspicion of foul play, an autopsy can be ordered. Not every individual upon passing is going to have an autopsy done. It can be ordered if there's a concern for public health. And families can ask for an autopsy from the hospital, and it's free. There should not be a cost for performing an autopsy. The procedure for an autopsy, there's several different steps, but first off, it has to be done with respect and seriousness. So sometimes on TV, they're kind of like joking around doing it. That would never actually happen. So first, the outside of the body is examined before the body's cut open, obviously. So a scalpel is used to open the body using what's called a Y-shaped incision from the shoulders down to the mid-chest, and then down to the pubic region. To examine the head, there's a second incision made across the head and down below and behind the ears. The scalp, soft tissue from the front chest are reflected, so they're pulled back to examine for abnormalities. And then a saw is used to open the skull and ribs and breastbone. In the abdomen, large intestines are freed up. Brain is cut free from its attachments. Inspection, so the chest organs are basically removed, and fluids like blood, urine, bile, so bile's formed in the liver. It's kind of like, ooh, you know that bad taste that you get when you throw up? That's your bile. It's used as your digestive fluids. And fluids from the eye can be sent for a chemical study at a microbiology lab. The organs are individually weighed and inspected. So they look for any abnormalities as they're inspecting the organs, and then they take a small biopsy, a little section from each one, and place it in a preservative solution. The reason for that is they can't preserve entire organs, so they can take a small section, and then if they need to do toxicology results later, after the results come back from microbiology, the microbiology lab, then they can see whether or not they need to test for toxins in the body, which can take a lot longer than the autopsy. All the major solid organs are going to be weighed on a scale. And then after the examination, the organs are returned, cremated, depending on what the law permits and what the family wishes. Body is then sewn back up using what they call a baseball stitch. So, it's, if you've seen a baseball, then you're a normal person in America. Body is washed and it's ready to go. So basically at that point it would be ready to have a proper burial service performed. All tissue samples go to a histology lab, and final conclusions can be drawn. And then a month later, the final report